My 5 uncles raped me at a go. Then they had pieces of razor blades and bottles. They put them together, small pieces. They put it in my mouth and forced me to swallow it.
Akamlazimisha na akamwambia akisema atamuua. Sasa akachukua karatasi yenye walikuwa nakula mandazi huko na usiku ndio alimtumia nayo.
After sodomizing me, she left me unconscious.
Akafanya sex na sisi, wakati alimaliza akatuambia mwenye atasema anamuua.
Alikuwa ameniingiza chini ya meza hivyo, lakini shingo yangu mahali ilibaki alikuwa akibaki akininyonga, lakini amefunga mlango.
Gender-based violence, particularly against women, has been on a rampant rise in Kenya. Between April 2015 and March 2016, of the 3,366 reported cases, 2,486 were sexual and 880 physical violence. Out of these, 89% of all reported cases of gender-based violence are reported by women and girls, 11% by men and boys.
It started way back when I was almost 7 years. That is the first time I encountered rape through my dad. And it was a continuous thing. It happened continuously for a while, for years. Then I ran away from home, went to stay with my grandma. And I kept quiet because I was told talking about such a thing is wrong. It would destroy the family's reputation and all that. So I kept quiet. It's exactly 2 years today. And thieves attacked me in my house, stole everything, beat me up, and they raped me again.
Nilikuwa nyumbani, Vincent akakuja shule. Mtu akamdanganya hapo kwa barabara, kwa hiyo njia alikuwa anapita. Kuja nikupe 20 bob ununue mandazi. Juu Vincent anakuanga social sana na watu. Sasa akadhani bado tu rafiki wa kawaida.
He told me let's go to his house. He sodomized me using nylon paper. After sodomizing me, she left me unconscious. I came to school and I explained to my headmaster. I started with knowing that I am HIV, but when they gave me medicine, I come to realize that those medicine there were ADVOCACY, which helped me after some times.
Every Sunday after service, tulikuwa tunabaki boys na girls kwa church tukifanya practice. After practice, pastor akatupea mafuta ya olive, tukakunywa. Ile nyingine akatupaka, alafu saa akatuambia tutoe nguo, tukatoa. Alafu saa ndipo akatuweka kwa kitanda tukua sisi wote watatu. Alafu akafanya sex na sisi, wakati alimaliza akatuambia saa mwenye atasema anamuua. Hiyo mambo yote ikifanyika sikuongea na mtu yote. Saa nilikuja kuambia mama wakati aliniambia niko pregnant. Ndio nilikuja kumwambia kila kitu.
Women are more likely to experience physical violence committed by their spouse or partner than men. Cases of violence among men and boys are said to be relatively low, although this may be because most of them go unreported, mainly out of fear of ridicule and stigmatization. Gender-based violence is a violation of human rights and a form of discrimination. It includes all acts of violence that result in or likely to result in physical, sexual, psychological, or economic harm or suffering, including threats of such acts, such as coercion or arbitrary deprivation of liberty, whether occurring in public or in private life. The Gender Violence Recovery Center, GVRC, is a non-profit-making, non-partisan charitable trust of the Nairobi Women's Hospital. GVRC's main purpose is to bring back meaning to the lives of survivors and their families through the provision of comprehensive free medical treatment and psychosocial support to survivors who have suffered various forms of violence, such as domestic, physical, sexual, psychological, or emotional abuse.
I was working in a certain hospital, and I was trying to push the administration then to start a women's wing in that hospital. Cut a long story short, I developed a business plan. At around the same time, another incident happened. This lady came, she's a well-known personality in the country, and she had been gang raped by 11 boys in industrial area. So she came in a bit late, a bit distraught. She didn't have her ID, she didn't have any medical cards, she didn't have any money, because obviously everything had been stolen. And we couldn't give her services because the policy of the hospital was that you must be able to produce one of those. I went to see the CEO the Monday morning. The incident was on a Sunday afternoon, and I explained to him what had happened. And I told him, look, for people like this, I feel as an institution we should be able to provide free services. So he said, I have all this and I like it, but when you start telling me we give free services, I get very worried. Why don't you go start your own hospital? And so when we were opening doors, I got a few people in between October and March. I got a couple of people to join in. I was very clear, even to my initial investors, that anybody who will ever come to us, whether male or female, we're going to give them free services. And that's how then the GVRC started.
GVRC envisions a society free of gender-based violence. We do this by being the center of excellence in both the prevention and management of gender-based violence. And so the prevention is done at a countrywide basis where we create awareness on gender-based violence. We also enhance the capacity of different service providers to be able to provide the medical treatment in the whatever health facilities that are there, and also the police stations, the judiciary, the children's home, the shelter home. So we create awareness across different service providers to be able to provide gender-based violence services again.
The Gender Violence Recovery Center has a tripartite approach to management of gender violence, that is, medical management and psychosocial support, primary prevention, and advocacy. Besides medical management and initial counseling, survivors receive various types of psychological and social services, including individual therapy and group therapy, with facilitation of support groups in each of GVRC's centers for various target groups.
Wakati nilienda support group, nilikansoliwa kabisa cause I wanted to commit suicide, and then pia naona mi sifai, yani najidharau. So after counseling nilianza kuchange zile fikra mbaya zikaanza kuniondoka. Halafu saa wakati waliniambia niweza abort mtoto, nikose mtoto kabisa maishani mwangu, nikaona acha nivumilie hiyo pregnancy, halafu nikipata mtoto pia nirudi shule.
It has grown me, especially emotionally, and that is why I will always go there to tell others, you cannot dwell there. There is a life outside that pain and that trauma. Sometimes you speak to yourself and tell yourself you're able to make it, but you need a person to tell you you can make it, because there are battles in life that you cannot fight alone. You need backup, and that is exactly what I received in GVRC.
GVRC places pivotal importance in having a society free of gender-based violence, and as such, it has a potent primary prevention arm aimed at creating awareness, facilitating behavior change, equipping diverse stakeholders with skills, knowledge, and sharing best practices in regard to gender-based violence response and prevention, as well as child protection.
We have two policies. There's one that is internal, which is the child protection policy, which every staff who works with plan needs to sign. It's basically to protect children against all forms of violence. It's protection both at the workplace, protection at home, but also protection within the work that we do. It's to ensure that we do no harm to children. It's to ensure that we report all cases of violence against children. It's to ensure that we protect children in every capacity that we can and which we have resources for.
With GVRC, we've been able to capacity build teachers in various areas and in the various counties. And through this capacity building, we were able to create a number of child protectors who are teachers, and we call them champions within certain counties.
We have actually taken these pupils through rigorous training so that they can be able to protect themselves whenever they are abused.
GVRC has played a key role as the learning point for the establishment of gender-based violence service centers in public facilities in a number of counties.
GVRC has paved for us way because, for one, it has improved our capacity building in terms of training the healthcare workers who are now able to serve the clients who come to our hospital. And then it is all over in the hospital. It is all over sensitized that the GBV now has a department. There is someone working at the GBV, so clients are able to be linked very well to the GBV clinic.
GVRC is also spearheading 2 nationwide gender-based violence awareness and prevention campaigns: the 72-hour campaign and the Become 1 in a Million movement. Become 1 in a Million, launched in July 2012, is a national social movement created to address the root causes of gender-based violence by building positive practices in Kenya and encouraging everyone to actively engage in various activities that build social, cultural rejection of gender-based violence. GVRC Advocacy Docket, in collaboration with other stakeholders, successfully included protocols of gender-based violence management into the Bachelor of Science nursing curriculum that is being used in 14 universities in Kenya. GVRC held an active membership at the Task Force on Implementation of Sexual Offences Act 2006 and Nairobi Hub, a group of organizations in the gender-based violence sector responsible for putting up emergency response plans in preparations for the national disasters. GVRC has actively contributed in development of the national guidelines and standards of gender-based violence management, as well as development of the post-rape care form, gazetted in 2012, among other achievements. GVRC advocacy activities on gender-based violence target decision-makers at community, county, and national levels.
We ensure that we integrate principles of equality in laws, policies, administrative processes. So when we joined the commission, we started the working group. The working group brings together state actors who are government bodies and non-state actors who are civil society, private sector and the like, working in the area of prevention and response to gender-based violence. So I have indicated one of our roles is to coordinate. So we coordinate meetings that happen here monthly.
In addition, temporal shelter is provided to survivors, and access to justice is enhanced through chain of evidence management and providing expert medical testimony in court. Since its establishment in 2001 to 2017, GVRC has brought back meaning to the lives of over 36,000 survivors and their families through free comprehensive medical and psychosocial support. Currently, the number has grown to over 3,000 survivors annually, translating to an average of 8 to 10 gender-based violence cases per day. Gender-based violence poses significant costs for developing economies, including lower productivity and incomes, lower rates of accumulation of human and social capital, and the generation of other forms of violence, both now and in the future. Treating a case of gender-based violence costs an average of 23,500 shillings for outpatient services. For inpatient, the cost ranges from 32,000 Kenya shillings and can go up to 2 million in special cases as corrective surgery is normally required. These costs are, however, exclusive of the fees associated with rescues and the legal process.
We have different development partners. We have the Danish Embassy through the Danida. So we have Danida supporting us on a multi-year funding to be able to provide. Theirs is the cost support to GVC.
Regarding our engagement with the Gender Violence Recovery Center, I think that is an engagement that both aims at helping the center addressing the immediate needs of their clients, but also to develop their methods and the approach to countering gender-based violence. We are signing now a new agreement that will cover the next 4 years, which is the duration of our present country program. And during those years we will continue to be a close partner of the center.
We have the Nairobi Women's Hospital who provide a lot of support to GVC, both on a technical expertise, on space, on infrastructure, and they also provide support to us in terms of paying, for example, the staff costs. We have Plan Kenya, Plan International. They really help us with the child protection programs. We have the European Union that's also supporting us. We have Africa Women Development Fund who fund us over periods of time, but they've been consistent also. We have the UN Women, the UNICEF, that's generally the UN agencies. So those are some of the supporters that we have at GVC.
One of the things I would like to say about GVC is that it's actually one of the centers of excellence that we have. Actually in Nairobi it is the center of excellence. They've really been able to provide a lot of services. We've collaborated very well with them, and I know from their center they do report their data to Nairobi County, because if you work in a certain county, then that data is supposed to go to the county Department of Health, so that then we have the data.
We are expanding now. We have two kinds of expansion. One is internal expansion, so upgrading the facilities that we have. So survivors of GBV now will be able to access better facilities and will be able to do much more.
GVRC prides itself in being a center of excellence in the prevention and management of gender-based violence in Kenya. Maintaining standards of excellence is top priority in the organization's strategic plan. The center continues to live up to its mantra, bringing back meaning to lives of survivors and their families.